Welcome everybody to the first Adult Social Care, Health and Communities Overview and Scrutiny Committee of this new term. I would like to start off by saying that I am the chairman tonight, but on Thursday at the council meeting, Councillor Purser is going to be elected chair moving forward, so that's why he's here tonight. So it's a bit of a strange arrangement for this evening's proceedings. I'm going to start off, because it's the first one, by just doing a little introduction of everybody. My name's Adrian Cartwright. I'm a councillor in the Headlands ward. I also work in adult supported living facilities. That's my interest in this area. And one other thing, please use the microphones when you speak because we're being live cast.
Good evening, everybody. My name's Hayley Adkins. I am councillor for Duston Ward and vice chair here tonight.
Vicky Rockwell, Head of Community Safety, Engagement and Resettlement.
Jane Carr, Director of Communities and Opportunities.
Susan Gaskell, Councillor for the Moulton Ward.
Scott Packer, Talavera Ward.
Joanne Blythe, Headlands.
I am Fartoon Ismail, Councillor for Castle Ward.
I'm Christine Ware. I'm councillor for the Naseby Ward, but tonight I am deputising for Andrew Simpson, who is councillor for Braunston and Crick.
Thank you. Richard Woods, Democratic Services Officer for the Council.
I'm Bob Purser. I'm councillor for Abington and Phipsville Ward, and I'm a visitor this evening.
Thank you all very much. Over to you, Richard. We'll start the meeting.
Thank you, Chair. Apologies for absence. We've received apologies from Councillor Fiona Baker, Councillor Cameron Emery, Councillor Rosie Herring and Councillor Andrew Simpson. Councillor Christine Ware will substitute for Councillor Andrew Simpson, and Councillor Alison Eastwood will be approximately 30 minutes late. Thank you, Chair.
Thank you. And do we have any declarations of interest from the members? No, thank you. Okay, the minutes of the last meeting. I don't think there's anybody here that's a member that was at the last meeting. Do the officers here, were they here?
Some of them were, Chair, but just to say the minutes were published as draft in advance. They were then published with the agenda papers for the meeting tonight. So there has been an opportunity for members who may be members now, who may have been members then, but are members of the public now, to identify if they thought there were any inaccuracies, and indeed for officers to do the same. no one has raised any issues in advance, so hopefully that can give the current committee confidence to approve the accuracy of them.
Okay, thank you very much.
So,
do I need to take a vote on that?
if you could invite the committee to, if they're happy to approve the accuracy.
Okay, there we are. Can I ask the committee to agree to the minutes of the previous meeting, please? Show of hands. Thank you. Okay. Some housekeeping. There are no planned fire drills this evening, so if the alarm goes off, follow the instructions from our Democratic Services officers, please. And ensure that your mobile phones are either on silent or turned off, please. That would be very helpful. Okay. We're ready to receive the report from you, James, if you're okay with that.
Certainly, Chair. So, members who attended the training, the induction session on overview and scrutiny, may recall that there is a requirement on authorities that adopt the Cabinet system of governance to also have an overview and scrutiny function. That overview and scrutiny function carries out the roles set out in paragraph 5.1 of the report. So, holding to account the Cabinet, contributing to policy development and review, monitoring performance and scrutinising external organisations. So there's a requirement to have the scrutiny function to carry out those roles. There's a lot of local choice down to individual authorities as to how they structure their overview and scrutiny functions. WNC operates a model based on thematic scrutiny committees, of which there are 3, and they have the respective remits set out in paragraph 6.1, page 17 of the report. So, in the case of this committee, it's responsible for carrying out scrutiny in relation to the areas of adult care, public health and well-being, mental health, health scrutiny, culture, leisure and community safety and regulatory services. So this report really intended to set out for this committee, as for each of the other 2 scrutiny committees at their first meetings, their remits, the areas they're responsible for scrutinising. Happy to take any questions, Chair, but as I say, I hope the report speaks for itself.
Anyone have any questions on the report? Thank you. Yeah. So the committee is asked to note the areas of our remit as set out in paragraph 3.1 of the report. Just show of hands. Thank you. That's noted. Okay. Item 6. An overview of the key priorities, risks and challenges for the service areas within the remit of the committee. We have a speaker, Mrs. Lineker. You'd like to address the committee? You can have 3 minutes, madam.
I can't get it in within 3 hours.
And Mrs. Lineker is going to speak on hospital care and aftercare for older people and people with dementia.
Yeah, that's right. I first want to speak about dementia, especially on assessments when you're assessed at home. The assessments take too long. You need them done as quick as you can for dementia people. I know of quite a few people that have come to me as carers and said this, because I'm on the carers committee. The problem is it takes too long to assess, and it's the assessment that needs changing. It needs to be quicker and faster. dementia people need to be more taken care of, whether they're young, old, or any other age. Also, the assessment with other people in hospitals should be assessed when they're coming home and not got any help when they go home. This is another issue on hospitals. The problem is there's no adult social worker there. There is the one carer there, that is all, that will help people with care, but they can't do everything in hospitals. We need more social adults for adult care in hospitals, especially when they've got COVID and they get home and they've still got COVID. I know of several people that have not been told they've still got it. And also, one elderly lady that I know, and I'm not going to mention no names, I never do.
1 minute left.
She's 90-odd years old and she was shoved in a laundry room at the hospital because of the assessment that was being taken out. She landed back in hospital, still with the same thing in the laundry room. I find that's disgusting. Sorry. End.
Thank you very much, Mrs. Lineker. Okay. The committee will now receive 2 separate presentations regarding the service areas within its remit, one covering adult social care and the other covering community safety. Mr. Cox, would you like to go first, please?
Yes, thank you, Chair. So we're going to start by presenting the priorities, risks and challenges for adult social care. If we could just scroll down to the next slide. So just as a reminder, in terms of the role of adult social care, which was covered at the members' induction session, adult social care provides a wide range of support services which are designed to help adults, particularly older people, those with disabilities or people with a physical or mental health condition. And our aim and our focus is to help people live independently, safely and with dignity. And we do this by providing support such as help with personal care through washing, dressing and eating, help with domestic tasks such as cleaning and shopping, and also helping people with support to access their community and stay active and connected with relationships with people who are close to them. And this can be in people's homes, in day centres, in residential or nursing care homes as well. And in addition to this, we also support family carers and provide short-term reablement and rehabilitation services to help people regain their independence after an illness or an injury, all with the focus of promoting well-being, choice and independence and making sure that people receive the right care at the right time. So if we can just scroll down again. So in terms of our key priorities, I've mentioned promoting independence, but also preventing hospital admissions. So we've got a real strong prevention focus, which looks at how we can support people within their own community. So using both the strengths of the person in question, but also the strengths of the community and the assets that are available within that community to help people live as full and as an active life as possible. We put investment in home adaptations and particularly the growing use of technology to help people live independently in their own home. And we also can start short-term care and support when people's health may temporarily deteriorate or they may need some additional assistance, again, to help them stay at home. We've got a big focus on currently on working
with our health service partners and integrating services with them. So members may be aware of the 3 big shifts which are being focused on by DHSE, which are from hospital to community, from analogue to digital, and from sickness to prevention. And to support this, we're identifying opportunities where we can deliver enhanced collaboration with our local health colleagues. So looking at the potential for integrated neighbourhood teams, which would enable us to have a more holistic view of a population's needs, and also become more both responsive and proactive at the same time. On top of this, we provide another one of our priorities is providing support to our local care market. So this is through ensuring that we've got the right workforce in place and capacity to deliver services, making sure that the market is sustainable, both through our fee setting and our general oversight of capacity, and making sure that we've got the right blend of care in place. We also ensure that local providers understand our direction of travel to meet the future needs of people who may rely on social care in future, as well as the changing demands of people who currently access adult social care and support, and the volume of people who need our assistance as well. We have a strong focus on financial sustainability and reform, so managing increasing demand with increasingly constrained budgets, and also inputting into national discussions around what reform looks like for adult social care. And members may be aware that the KC Commission is currently sitting and considering what the future of adult social care needs to look like. And then moving on to the last point, which will be the next focus of this presentation, quality assurance and regulation. So we are prioritising strengthening our internal governance and performance monitoring arrangements, as well as our quality assurance frameworks. And this is all in preparation for our CQC local authority insurance inspection, which we'll talk about in more detail. So if we go down to the next slide. So for members who aren't aware or are new to the committee or new to the subject of adult social care, the Health and Care Act 22 gave CQC powers to regulate adult social care departments across the country. So the main focus is to make sure that we are discharging our Care Act duties appropriately and demonstrate that to CQC. So this will be the first time in 10 years that adult social care departments have been inspected. Prior to this, we've undertaken a process of sector-led improvement, which has focused on peers from within the region, undertaking local assessments on areas where we invited challenge and scrutiny. So a lot to prepare for in terms of a new inspection regime, which looks like, if we roll down, so this is the CQC single assessment framework. So, and these are all the elements that go into assessing a council. So as you'll see on the bottom layer, we've got evidence which comes from data and information. So this will be publicly held data and information which helps CQC form a view of areas where we're performing or we may need to strengthen. They also take on board people's experiences, both people who are using the service as well as providers who we work with and community stakeholders as well. And then we get judged against quality statements which are laid out within our self-assessment, which we'll come on to talk about in just a second. And this is to demonstrate areas of quality assurance and making sure that we're delivering against expectations. The 5 key questions at the top is what our provider services get judged on but aren't applicable to the assessment of local authorities and integrated care systems. Okay. And going back to those quality statements, these are the 4 areas which CQC focus on. And as we talked about on the last slide, they triangulate our performance by considering how we've judged ourselves against quality statements, the publicly available information and evidence that they've got through statistical returns, and also people's feedback in terms of how we're working. Now, during the course of the last 2 years, we've undertaken a self-assessment exercise. Not sure if members have had the chance to read through that. It is available on our internet pages. But this gave an overview of how we felt we were performing in all of these areas. And just over the course of the next 4 slides, just like to talk members through where we judged ourselves in terms of that self-assessment. So on the first theme, working with people, we talked about our alignment with the Live Your Best Life strategy, which was developed in partnership with our integrated system partners, and our focused on a strengths-based approach and ensuring that our services were connected with the communities in which they operate. Our community teams are all aligned with local area partnerships, and over the course of the last 12 months we've incorporated wellbeing advisors into those community teams to make sure that they've got a stronger prevention focus. In addition to this, we also have information on our services available online and in our welcoming spaces. We use a free conversations model to assess people's needs for support. So that is focusing on a first type of conversation which looks at general support and assistance that people can be linked into. The second conversation is where people may be in crisis and need a short-term response, and focusing our efforts there. And the third conversation is around longer-term care and support and making the arrangements around that. Over the course of the last 12 months, we've implemented a new case management system and financial systems to improve the data that we capture, but also the efficiency of our internal processes to support with the overall operational delivery of our service. From our front door, we have direct contact going into our community teams for urgent requests, and we're also working with our customer contact centre so they can deal with more low-level inquiries for us, so we can focus social worker time on dealing with more complex and more involved matters to just enable with the management of flow through the service. Unfortunately, we do have waiting lists in some parts of our service. However, we do monitor those on a daily basis and prioritise urgent cases. And over the course of the last 12 months, we've implemented tools and waiting well principles to make sure that anybody who is on a waiting list, we're checking in to make sure there's that their situation hasn't deteriorated and they're getting all the support that they need. And then finally, around equity and experience and outcomes, we use data to address health inequalities and ensure fair service delivery, and target our engagement with harder to reach groups to reduce barriers and inequalities that may be present. We're also working on the implementation of the Diverse by Design principles, which were created by the Local Government Association, both with our internal workforce, but in terms of our operational practice, to create a more inclusive and equitable approach to service delivery. Ashley's going to take the next theme.
Hi everyone, thank you. So for providing support is around how we work with our care market, is how we work with partners and how we work with the voluntary sectors and community sectors as well, and factor them into our market shaping plans and our plans to meet the needs of people that are eligible for care and support from the council. So in terms of partnership arrangement, we've got Integrated Care Northamptonshire in place. That was established in July 2022 with the purpose of unifying healthcare and wellbeing services. The good part about that is that all partners within Integrated Care Northamptonshire have signed up to the Live Your Your Best Life strategy, and they have 10 shared ambitions which they've all committed to working towards. And that approach is supported by the Health and Wellbeing Board and forums. We have our local area partnerships. They have been really useful for us, particularly from a market management perspective. So they broke down our population into pockets of 30,000 to 55,000. Each of those 9 local area partnerships have different needs. Some have more needs to focus on social isolation, some on youth mental health. It can vary, but it allows us to have that focus on the priorities broken down rather than from an entire West Northamptonshire approach where the objectives of different areas are not aligned. We have initiatives including access to bikes and expanded sports access, and LAPS are becoming the council's target operating model as well. We also have the Better Care Fund. The Better Care Fund is a very complicated, integrated, pooled budget. I could do an entire scrutiny session on that myself. You probably don't want me to, but as an overview, it's about £60 million of shared money between adult social care or the council and the ICB. It is designed to enable us to integrate services so that people have better integrated support that meets shared priorities, such as admission avoidance, discharge from hospital, but also really important things like supporting unpaid carers, re-abling people to maximise independence. It's all contained within the Better Care Fund, and that's kind of what we use as our vehicle to drive particularly commissioned integration. Around market shaping and sustainability, last year we published the West Northants' first market position statement and our sustainability plans. So in effect, the market position statement, which is published on our website, is primarily used for people or providers who are interested in working at West Northamptonshire, so they can easily identify where there are gaps in the market, when commissioning or contracts are going to expire, and when they'll have an opportunity to come and work in West Northamptonshire. It uses data from our joint strategic needs assessment to formulate a picture of what our population looks like to enable effective market management. We implemented a 10-year care home framework. We've got pretty much every care home in West Northamptonshire, bar a couple, signed up to it. Very sustainable, very successful contract. We put in a new home care framework where we rationalised our market. So without going too far back, post-pandemic, home care was a very, very fragile market, particularly in West Northants. Workforce was burnt out and a lot of people were leaving the sector. We've managed to rationalise that market. So we had 97 contracted providers. We reduced them down to 15 to drive economies of scale. And for context of that, in 2021, we were delivering 17,000 hours of home care per week. We're now delivering at 21,000 home care hours a week with 15 providers instead of 97. So that's worked really well. And we work on initiatives to improve discharge times and home care capacity as well. In terms of care quality, our CQC care profile doesn't look great as West Northamptonshire. It is below the national average, and there are some challenges as to why that is. West Northamptonshire has one of the highest amount of uninspected regulated services, so particularly in home care. So they're still waiting for their first inspection and don't actually have a rating yet, but the way the question's asked around how many providers are good or outstanding includes the uninspected, which drives that rating down. So we're working with the CQC local inspection team to sort of improve those rates of re-inspection. From a local understanding of quality perspective, we have at the moment 10 providers who are of concern out of a total market that we manage of 216 providers. So not the greatest place we want to be, but not as bad as what our CQC profile would suggest is a concern for us. In terms of our workforce is very diverse and robust. It wasn't always, particularly post-pandemic, but there is resource and there is capacity out there at the moment that enables us to have shorter waiting lists than what we've experienced before in terms of people waiting for actual care and support. We do have some concerns around the international sponsorship scheme. Whilst it has been really beneficial to bring care workers into West Northants from overseas to ensure that people had the care and support that they need, there has been instances where organisations have misused the scheme, and people, and particularly staff, have been treated really, really badly. We are developing an ethical migrant worker charter that we have co-designed with our care market so that they understand what their responsibilities are as an employer, so that people don't come over here to do some jobs which are really challenging but get treated terribly. And I don't think anybody really wants that. We do have quite a lot of international recruits in the West Northamptonshire market. At the time the self-assessment was written, there was over 700. It's over 1,000 that we have now. That's obviously going to slow down because of the government's decision to end the international sponsorship scheme. So that's a potential workforce risk for us in the future, but we've got our own. Every single provider is risk rated against the amount of international sponsorships that we have, so we've got a really tight grip on that. From an accommodation perspective, we have just launched our supported living framework. Supported living is where people can access often 24-hour supports in their own home. Went live at the beginning of June. It's a 5-year strategy designed to ensure that the right services are in place for our supported living people who would like to stay at home but do have more intensive levels of need. We have got plans to develop a new extra care facility in the centre of Northampton, and that will help people of all age to have their own accommodation but with lower amounts of care and support. And at the moment we do have 81 people waiting for a supported living package, but we think that will reduce with the new contract going live, but we are closely monitoring it. I'm very nearly finished, but I apologise, it's quite an intensive area. In terms of out-of-area placements, the CQC will come and look in and say, how many out-of-area placements do you have and why do you have them? And what they're really coming in to check is, do you have gaps in the market? That means you have to place people out of the area. Challenging question to ask when we were a county council, because we still have a lot of legacy placements where people are in Northamptonshire. So we've taken a robust view on that we don't include people who are placed in Northamptonshire in those numbers. So there's currently 80 people placed out of county or out of West Northamptonshire. At the moment, there were 8 new ones in 24-25, and just to give some reassurance, all 8 of those was because of choice. So family choice, so family members lived out of the area and they wanted them to move close to them is the primary reason why people move out of area. We have small gaps in our market, but not sufficient gaps that would mean people have to move out of the area. Last 2 then, so co-production as well, something that they look at. So there's a very big drive for when we design pathways and services that we co-produce them with the people that access the services. So last year we introduced our co-production framework, which is a council-wide approach which sets out our principles and our commitments to co-producing with people. Since then we've driven that further. We've commissioned a voluntary sector organisation to run a co-production register for us to get people to sign up to agree. We've got a remuneration policy in place where people who do work with us to co-produce will be paid for their time and expenses. And we've created a co-production board which is chaired by people who access or utilise our services, and they hold us to account around our co-production principles as well. So that's in a really good place. And then in terms of partnership and community, so we do quite a lot of joint and aligned commissioning, particularly for mental health, learning disability and autism services, which are probably more of our challenged areas of the market. So it's really useful that we work in partnership as well. We have just agreed that the ICB will be joining our care home framework as well, which makes managing that market a lot easier as well. And with everything that we do within our principles, we always explore whether integration is possible for the sole purpose that services are more lined up and joined up for the people who have to access them. So we'll keep pushing that integrated approach as we go forward. And I've stopped talking now. Thank you.
Okay, so on theme 3 around ensuring safety, areas we highlighted within our self-assessment were the culture of safety that we've created with an emphasis on learning from incidents such as safeguarding adult reviews to improve our practice. We have a strong focus on becoming data-driven, so making sure that when we compare our safeguarding data with our local population data, we're able to identify risk patterns and make sure that people are receiving the support that they should. We also highlighted the success of our adult risk management procedure, which brings multi-agency partners together to support high-risk individuals who aren't eligible for traditional safeguarding support, but works with them to tackle any issues and challenges that they may have. And then in terms of ensuring that our pathways into adult social care are safe, we've got a focus on assessing the effectiveness of our moving into adulthood approach, as well as our hospital discharge approach, and obviously we'll be picking up the comments and feedback from the speaker earlier who raised some concerns in that area with the teams. Fortunately, there were no provider failures during the previous financial year, but we did engage in proactive conversations with providers who were at risk, which Ashley has talked about as part of the previous slide. And we have a joint quality board in place with the Integrated Care Board and the Care Quality Commission to oversee the general any general issues around care quality within the area. We work with our Northamptonshire Safeguarding Adults Board partners to deliver on the Safeguarding Adults Board strategy, which is informed by local risks and has a clear set of priorities, which are subject to independent scrutiny and monitoring of performance. And we've also done intensive pieces of work around understanding our referral rates and making sure that those are appropriate in comparison to national data and guidance. One of the sort of final areas on this theme that we focus on as well is around deprivation of liberty safeguards. So we've got a high volume of pending applications, which we again have to prioritise based on risk, which we do by following the ADAS guidance that's provided, and during the course of the last 12 months, we've also developed our community DOLS framework to guide staff around the escalation of high priority cases which need to be taken to the Court of Protection. And then the final theme, just in terms of CQC and our self-assessment, is all the internal stuff around leadership and governance. So we've placed a strong focus on workforce development and recruitment to key roles, such as our practice educators and practice development leads. We've undertaken reviews of enhancing our learning and development programmes and supporting apprentices to join our workforce as well. Ashley's touched on co-production and feedback, so I won't say any sort of more on that. But we have got clear improvement plans in place, or clear service plans in place, which set out the strategic direction for adult social care and align to the Council's values and residents' needs. And to develop these plans, we use feedback from residents, which we also use to improve services as well. So if we just move on to the next slide. So this is just the end-to-end process for CQC. Now, we received notice of our assessment back in March, at which point we were given 3 weeks to put together our information return, which is at the third step. That was submitted on the 28th of March, and we're currently awaiting notification of when our on-site visit will be. At that point, our senior leadership team meeting will also be arranged. So we expect that any week soon. We will get 10 weeks notice of when assessment will take place. So on the basis that if that came through next week, that would take us to probably the second week of September. and then once assessment is completed, reports can take anything from 3 to 6 months to be provided and then published. So we're in what is quite a long process and what is still a very new process. However, we'll obviously keep this committee updated and engaged throughout that as well. Just finally, sort of moving on to key risks and challenges. So obviously the key one for us is around increasing demand. So people will be aware we've got an ageing population and the number of people above the age of 65 is growing rapidly. That brings with it a natural challenge for adult social care services. At the same time, we're seeing that growth in demand. We're seeing increased complexity in people's needs, obviously living longer, developing more comorbidities and multiple needs, which we have to respond to. We have increased pressure to discharge quickly from hospital, given the position of our local hospital and the capacity it has for admitting people and making sure there is that constant throughput of patients. We're seeing lots of changes around disability and long-term conditions. So we know that there are more adults with learning disabilities and physical disabilities, but people are also living longer and requiring lifelong support. Advances in medical care have meant that people with complex needs live much further into adulthood, which then obviously sort of creates a pressure on resources. We know that changing family structures also has an impact on the level of care and support we have to provide. People are far more dispersed now, and having informal carers in place is probably not as common as it once was. So we have to respond to that as well. And then finally, social and economic factors. So people living in poverty or with unstable housing, social isolation, all increase people's potential care needs. And health inequalities mean that some communities experience higher levels of need earlier in their life. And as we've mentioned with CQC assurance and with work around case commission, we're also responding to policy and legislative drivers, which also impacts on capacity as well. So the next slide on budget pressure, the box on the left is just to show members that we aren't alone in some of the financial challenges that we experience. These figures were taken from last year's ADAS Spring Survey, and they show an increase in the number of councils at 81% who were expecting to overspend on their adult social care budget. This year's figures are due out shortly, and I can provide those to committee members once they're received. But what we shouldn't do is lose sight of how much we've saved. So as a director at Adult Social Care, has saved £25 million since the formation of West Northants Council. However, some of the pressures that we have on our current budget are due to the legacy of disinvestment in non-statutory and preventative focused services prior to the council coming into being, as well as issues around demand and complexity, which I talked about on the previous slide. We also know that the cost of care is increasing, which creates a budget pressure. So for our care providers, they're the same as other markets. They have the same challenges around inflation, increased utility costs, labour costs, and all of these impact and increase the price we can buy care at. And we also are experiencing some challenges around shifts in cost. So there is a big grey area between health and social care needs, which impact on the responsibility of ourselves or local health partners to pick up the cost for providing support. And in adult social care, we're starting to see more costs that we would deem to have previously been related to health needs starting to hit our budget. And effectively, the result was that during the last financial year, our budget ended up being overspent by £8.3 million, which was 5.5% of our total budget. So Ashley will just take the slide on managing a sustainable market.
Okay, thank you. So obviously with the council, one of our key statutory responsibilities is to ensure that there is a stable market and that we shape it to meet the needs of local people. Can be a challenge. I think our market is in a relatively stable place at the moment, but there are some risks that are coming forward that we have to keep a close eye on. So from a workforce perspective, there are workforce shortages, but nowhere near to the likes of what we've seen previously. However, what the biggest concerns are is that it's very difficult to recruit frontline care staff locally. And that's been a challenge for a number of years to have a sufficient number of local recruits that are going to meet the needs of an ageing population. And home care sector has particularly been affected by the local recruitment. Care homes, much easier for them to recruit locally, but home care is a bit more of a challenge on that. And obviously, I think I mentioned earlier about the reduction in international or the stopping of the international recruitment scheme will later cause problems for us, which we won't see now, but potentially we will see later. Financial instability is probably a bigger problem for us, and the biggest challenge hitting all care providers this year was the government's announcement to increase and change the rules around the employers' national insurance contributions. So the independent care sector is largely made up of staffing costs. It's a staffing-led service delivery model. We work on average that 80% of all of a care provider's costs are related to staff. And in particular, things like national living wage, national insurance, etc., etc. The impact of the changes we estimated was about 2,200 per full-time care worker. Per year, which is quite a significant challenge for a care market that operates on a 6% profit margin. At the same time, the council was not funded to support providers with that. So we have done our best with the limited amount of resources we had to support them, but really we could only really support national living wage increases and increases to inflation. We undertook a detailed survey with our market to understand what the impacts of these changes would be, and we did have around 20 of the 97 providers that responded to us said that they fear they will be out of business within the next 12 months. So we are obviously tightly monitoring this and trying to provide intervention support should providers get to that stage. Market fragility is another area that West Northants has a plethora of small and medium-sized businesses. It has very few big national organisations. Big national organisations are the ones that generally can survive under these intense financial pressures. And whilst we grow our market, we are seeking to bring nationals in, but nationals are attracted to higher fee rates than the council can afford. So that operates as a bit of a challenge for us at the moment. And given that the rates that we pay providers are generally enough for them to meet their costs plus a 6% project, it kind of incentivises disinvestment in staff training. And then as a result of that, you can potentially later down the line see an impact on the quality of care being delivered. There are issues with morale and burnout. I think a lot of the providers we've seen that have kind of turned over in a while have cited that losing staffing because of post-pandemic morale and burnout issues, as well as limited career progressions with small and medium sized organisations has contributed to that staff turnover. And the demand potentially outpacing capacity, and certainly in some areas as well. So I think particularly around complex support and support for people with more complex dementia. Certainly we are seeing spikes in that. With that, you have a market that needs to adapt, but a market needs time to adapt to meet that. So we're working with them at the moment, but similarly with more complexity comes higher costs. And that's another thing that we need to manage. So a lot of different areas we have to focus on as we go through, but there are risks that we have a very sort of tight control of, and we'll obviously raise things when they are becoming at risky status.
And just for our final two slides, so we've mentioned 3 key shifts earlier in the presentation, as well as integrated neighbourhood teams. One of the other issues that's posing a potential challenge at the moment is the changes to integrated care boards. So for members that aren't aware, integrated care boards are going through a process of restructuring and what they term as clustering, so joining up with other integrated care boards so they can reduce headcount and I guess create economies of scale. That creates challenges because there's disinvestment from a number of local services which may have an impact on demand potentially down the road, but it also changes the potential nature of that relationship that we've worked hard over the last 4 years to cultivate, to make sure that we've got that sort of strong local knowledge and strong local focus, and how that may be interpreted in future. I've just mentioned this brings with it in added financial pressures, and I mentioned previously around increased focus on hospital discharge and community care. Obviously more care in the community is an increased cost to the adult social care budget as well. Finally, on regulatory pressure, policy and reform. So we've talked quite a lot about CQC local assurance. We also have the Mental Health Act going through Parliament, which will change the responsibilities of our mental health social workers, our responsibility for providing services such as advocacy, but also have a stronger focus again on providing more support in the local community as well. We talked about the Casey Commission, which is doing a piece of work on what the future of adult social care looks like. That's currently sitting but isn't due to report for at least 2 years. However, it may be much longer until we see recommendations from that commission implemented. But what I also wanted to do was just take this opportunity to sort of highlight all the shelved reform proposals, and not going to go through the details of them sort of one by one. But we have a long experience in adult social care of preparing for reform, looking at things that may impact on the costs that we pay, the prices that we charge, the impact on people, only for those to end up getting shelved or sort of pushed sort of further down the road. And this is just an example of some of those. So it is an area that does need that national change of focus, which hopefully the Casey Commission will be able to bring. And that's all we wanted to cover in terms of challenges. I'm happy to take any questions members may have.
Thank you very much, Neil and Ashley. Who has questions? Thank you, Christine.
I beg your pardon. I do beg your pardon. I'm interested to know if you can give us any update on the lapse, because I appreciate your move into the community, and my experience of the early stages of what the labs have been doing has been very positive. And I am aware of some changes that may be in the pipeline. I'd be grateful for any update you can give us.
Yeah, I'm going to hand over to Vicky, who's probably better placed to talk about that.
So we've covered some of the lab stuff in We're Next in the presentation. So I can, if we cover that, and then if it doesn't answer your questions, then I can give you another update.
Thank you.
Anyone else? Please, Bob.
Can I come in and ask to ask in terms of what this committee can do that's going to be useful to your area of work, what are the 2 or 3 areas where scrutiny would be of benefit to what all these challenges that you face, you know, because I guess some of them you'll be working within your management team, and that's probably the right place to be done. But are there areas where this committee could add value and actually make a contribution? Because I wouldn't have thought as a committee we want you just coming along to report stuff. We would want to actually make a contribution to the work that you're doing and these very considerable challenges that are coming up, some of which we've got control over and some of which we haven't. So it's sort of in the areas where we can actually have some impact that it would be useful for this, I think, committee to look at.
Yeah, so I think the first one would sort of be about getting that assurance. So all the challenges I think that we face are and how we potentially come out the other side of them will be dependent on how we work collectively, both with health partners, community agencies and partners on the ground. So Vicky will obviously talk and update on LAPS shortly. But I think when we start to think about sort of the changes within the health space and what's happening with health partners and the potential for integrated neighbourhood teams, I think we look at it really positively that the work that's been done on local area partnerships gives us a massive foundation, or a really strong foundation to start building into those integrated care sort of relationships and those integrated neighbourhood teams. So I think sort of as those proposals start to develop, yourselves as members are going to want to see or want to get assurance that there is a clear understanding about the potential of those teams and what they can do for the needs of local populations, how they're set up and how they're structured. But also that, I guess, one of those sort of final points around those changes in the ICB's arrangements, making sure that there is still that strong local focus around that provision of support and that provision of service that your constituents and residents in your areas really need. So I think that should be an area to understand how that's going on, but also to be able to feed in your own comments and observations on that. I think as we start to sort of work through, so we know CQC is going to provide us with an outcome on how they view our performance. So I think really sort of getting into the detail of what that looks like, and then how we pick up any actions coming out of that. Sort of clearly needs to be an area. Actually, just in terms of markets, is there?
Yeah, probably there's microphone. A couple of things I could potentially probably suggest. I think for one thing, it's noted that it would be really useful to have representation from the hospital trust and from the integrated care board here. And I think one of our challenges that we have and we're working through at the moment is the steer that the integrated care boards have had to go to make quite significant savings against their operating costs. So there are quite a few risks, I think, particularly towards the already diminished preventative services in West Northamptonshire, that potentially Scrutiny might want to consider that. And the other part is probably around care quality. And I think it's our intention this year to start working in partnership to drive improvements. So as we integrate contracts and commissioning arrangements with our integrated care boards, we want to use that as a vehicle to really drive quality improvement and to start a new programme of thematic quality improvement. So that might be something you want to consider as well. From a market management perspective, our biggest ones this year will be in the education area, so outside the remit of this group, but we are commissioning mental health supported accommodation, which might be the only one that you might want to scrutinise.
Can I just come back? Just when you're talking about prevention initiative, I think prevention is a word which is a bit like community, which everyone has their own what are we preventing? What's the focus of the prevention work we need to be looking at?
Well, there's very many different definitions of it, but ultimately all pointing in the same direction. So the Care Act describes it as prevent, reduce, delay. So that's prevent the need for care, reduce the need of for care, and delay the need for care. That's kind of our statutory responsibility. If Chloe was sitting here, she'd probably describe it as primary prevention, secondary prevention, and tertiary prevention, right? But it is, from our perspective, from an adult's perspective, it's preventing people from losing their independence. That is our biggest focus there, because nobody wants social care. And as we've been pointed out, they have to go through a quite intensive assessment process to understand whether eligibility for care and support needs for a service they don't even want. But they have to have it. So if we can focus attention more onto preventing people from needing those social care support services that can be intrusive, as well intended as they are, they can be intrusive, then that would be a really primary focus on us. For us, and there is currently a working group at the moment to deliver the adults prevention strategy as well, which you might want to consider as part of that as well.
Thank you. Councillor Harris has a question, please.
Yeah. Thank you. Thank you, Chair. Yes, a couple of observations as much as a question. Sorry about the noise. I'll keep it away. The thing that I want to say first and foremost is thank you to the team. I've had need through casework to interact with the team fairly recently, actually, over the last 18 months, on an upward trend, I think it's fair to say, and I have raised this with the team. I've certainly noticed that the need for people to get engaged with counsellors to seek support and help seems to be moving upwards, and I don't think that's a reflection on the team. I think that's just a reflection on the environment that we're in. But I think that I want to acknowledge that they have a very difficult job to do in very difficult circumstances, so thank you to that. There's a couple of things I think that I want to just flag from what I've heard this evening that I think that the Scrutiny Committee should seriously think hard about in its work. There's a very clear lesson that reducing or binning preventative measures, whatever they may be, does not work. We've seen that. We are now reaping the rewards, not the right word, but the downsides of those cuts being made in the first place. However difficult that might be, I think it's an important message for this committee to realise that preventative has got to be the right solution as we move forward. There's a number of other factors that are clearly compounding and coming together at the same time. Unfortunately, there is a small p political in the mix here because the NI funding. I'm shocked to hear that we might be losing 20 providers out of the number that was given. I don't know if this committee or this council needs to get more active as a campaigning council as much as anything else. I'm sure we're not alone in that issue, and I would appeal to my Labour colleagues to do whatever they can to make sure that that's fed up the line. But that's got to be the tip of the iceberg, and that concerns me hugely because that will create a massive gap for us. I have to mention also the international sponsorship scheme. I think that we're playing out to a degree of rhetoric here, and that is not going to help the situation at all. So I would appeal to all of the committee members here to please understand that this issue of migration, when it comes to care workers, is a necessity. It's not a luxury, it's a necessity. And we need to make sure that people understand that that is the reality of the situation that we have. So I felt it was important to raise those points and flag them. This committee has a big job on its hand. Thank you.
Thank you, Councillor Harris. Yeah, please.
Just on the thought of staff shortages and retention, I'd like to try and understand what is happening with a drive for recruiting people into the care, especially youngsters. Is there any real incentive there for youngsters coming up and into the carers?
It depends organisation by organisation, I think. I think the council was relatively successful at recruiting youngsters into our own frontline care services. I think the council's in a luxurious position of offering quite a generous benefits package, which is probably aids that as well, and it's more difficult if you're on a provider on a 6% profit margin. I think we work with a national organisation called Skills for Care, and Skills for Care do a lot of work on working with schools, universities, colleges, etc., about the benefits of moving into the social care sector. And they do a lot of activities in terms of generating national campaigns to drive recruitment locally. So there are initiatives that do happen, and we push it as an authority as well. Local recruitment, it's effective to a certain level, but certainly not generating the number of people that we would need to sustain, particularly in terms of our growth as well. But one of the areas that's on our priority plan for 25-26 is develop our adult social care workforce strategy, which in effect is going to outline, and obviously happy for Scrutiny to work with us on that one, but it's going to outline the exact numbers in terms of where our challenges are, and we will put in place a robust action plan to support the improvement of that area. I think the primary focus will be around training and development for frontline care staff.
Thank you for that. Are you looking to employ staff directly to do domestic care?
We do. So we have a certain number of services that we recruit to internally. So we've got 3 care homes, I think. Neil knows this better than me, sorry. 3 care homes, a very large reablement service that particularly support people to leave hospital and to be stepped down from needing formal care and support. We have our younger adults team, and we have a supported living service as well as day centres as well, and we all recruit to that. But despite the better terms and conditions you get from the council, we still have a lot of recruitment challenges ourselves. So I didn't want that to come across like we don't, because we do, and we always carry quite a significant volume of vacancies, which then impacts our ability to take on more people as well.
Yeah, I was just conscious of losing 20 external providers. Are we sort of helping others to pick up the slack? Are we picking it up? Do you have an idea of where that goes? Yes,
so our independent sector's robust enough to be able to pick that up, and in those circumstances, usually if a provider picks up care for another, then TUPE does apply, in which case the workforce does transfer over. The sustainability issues that we are potentially facing in the next 12 months are not to do with staff retention. They are to do with financial sustainability. That was what the feedback was. And that is obviously I think been through the reasons why that's been caused, but obviously our primary focus is listening and speaking to our care market and letting them come forwards to us when they do have concerns, and then we have to do a full risk assessment to understand that.
Yeah, thank you. One thing I was concerned about, some of the service users, if you will, the people that need the care, they don't always come from the best places. Do we fully inform the service providers of any risks that they may pose to the community and to other people in their facilities?
Yeah, so as Ashley described, there's quite a robust assessment process sort of determining people's eligibility. In terms of providers picking up support or putting in place support, providers will also do their own assessment. And part of that is to understand if they're able to meet the needs that have been identified within our assessment against the Care Act. And the other side of that is to also make sure that they've got the right provision and the right support in place that they can cope with some of these needs or any potential challenges. So yeah, there's a thorough and open conversation with providers around what the needs for support look like, and that sort of initial review of placements to make sure that they're appropriate as well.
Thank you. Anyone else have any questions? Yes, please.
How do the council meet the needs of the diverse communities who are not even aware of the adult services that the services done by the adult social care? Because I know most have language barriers. How do you reach out? How do you reach out to them?
Yeah, so it's definitely an area that we're always constantly sort of seeking to improve on and to improve areas. So we've got a lot of things that you would expect around making sure that information is available in different languages, that we've got links with interpreting services sort of where appropriate, so that people can have that sort of full and comprehensive assessment in a language which they're most comfortable with. I think part of the work around local area partnerships and focusing on local populations includes working with local groups. So we have to recognise that the council isn't always the most approachable body for people, particularly from diverse communities. So what we seek to do is work with as many local groups, voluntary and community sector organisations, where we know there may be groups of people with particular needs, so that they can support us in reaching those parts of the population, and making sure that people understand their rights but also understand where to go when they need help. But again, as we talked about in the self-assessment, it's something that we continue to challenge ourselves on, because we do know that people do find it difficult and challenging, particularly asking for help, but also navigating what is often a very complicated system.
Thank you. Any more questions? Okay, thank you very much, gentlemen. In that case, I'll move on to the ladies, please. We've got Jane Carr, Director of Communities and Opportunities, and Victoria Rockwell, Head of Community Safety, Engagement and Resettlement. If you'd like to begin your presentation, please.
Thank you. So just here to give you an overview of community safety, engagement and resettlement, which is quite a wide-reaching area, and then obviously allow you to ask any questions as we go along. I'll kind of talk through most of the presentation, but Vicky's going to come in on a couple of bits as well. So basically the focus of the service is primarily on prevention, and when we talk about prevention in this sense, we're looking to get as early upstream as we can with people and make sure that we're working with communities very closely, enabling change in our neighbourhoods and kind of taking with communities joint responsibility for some of the issues that we have and working through with them. We've been recognised by shortlisting for a couple of national awards as well, and then through our community grants part, we've basically this year, in the last 12 months, given out community grants totaling nearly 5.6 million. Not all of that is from base budget, so we've found other sources of grant funding from that as well. So we're really trying to work with not just enabling the communities, but finding grant resource for them as well to make sure that they can do some of the amazing work that they do. Community and also the community safety team has worked with partners to reduce crime, and for another consecutive year with mainly focus on tackling antisocial behaviour, child exploitation, domestic abuse and making Northampton town safer. So there's a lot of work that goes under that. The service vision is to build safer, stronger and resilient communities by making intelligent-led decisions that address local needs. So we aim to basically enhance social cohesion, address health inequalities, promote health and wellbeing and ensure that there's community safety, both in reality and also in perception as well, because there's a marked difference between the reality of some crime statistics and the actual perception that public have. Okay, and our place-based approaches that we take to priority neighbourhoods and vulnerable locations. So we try to focus on where the need is in the most, and we ensure that communities are well connected. So we're working really as that community connector, that lead for reaching out to the different communities and looking at what their needs are and taking them through a plan of how that will work. We're looking to increase partnership as well, so working with local community partners, including voluntary and community sector, increasing the early intervention and prevention offer, but not just with ourselves, but enabling others to do that as well, because there's absolutely no way prevention can be done just by the council. It has to be a wider community approach. And then trying to get thriving community and voluntary sector who deliver positive outcomes. We have in West Northampton an amazing voluntary community sector who are doing masses of work already. And I think, you know, we, in this team, we recognise that and we're trying to work with them in the best way and listening to their feedback about what they need from us as a council and what they need to really thrive. And then making sure our communities feel safe in their homes when they're out and about. In both of those areas, you know, sometimes it's perception, sometimes it's a reality, so working with those and ensuring that we're trying to entrench a sense of belonging in the area and a sense of pride that improves how communities come together and that our communities are simply valued for who they are. So that's an important part of what we do. So overview of the services. We have community safety, which is really focused on working to reduce crime and antisocial behaviour, kind of engages with residents. We work heavily in partnership with all of our key partners, such as police, fire, you know, all the communities, health, children's services. So there's lots and lots of partnership work that goes on, and that kind of culminates in the community safety partnership, which I chair as well. So yeah, that's the central point where we discuss strategies and put together, you know, action plans, and also where we're going to make investment. We look at that together in terms of what the needs and priorities are. And then community engagement and resettlement. So part of that is ensuring our communities have a voice through an engagement network, so making sure that we're getting input and feedback from our communities, shaping the work that we do through our town and parish councils, who are an important local part of what we deliver and also have really good local connections on the ground. And then through community leaders and community networks. We also, in that area, focus on supporting the government-funded resettlement programme, so that includes the Afghan resettlement programme and the Homes for Ukraine programme. And so that team also provides support where we have asylum-seeking hotels in the area, which are nothing to, you know, nothing to do with the council in terms of the Home Office place them, but we are still required to do a community response element as part of that. And then community development and local area partnerships, working at a neighbourhood level with our communities. There's another slide a bit later on that Vicky will explain the detail of that for you, but that's basically the base of the programme. So that's a really, that's a new approach through the Integrated Care Board that you heard about earlier, that works on those Live Your Best Life 10 outcomes, but works on it as community partners coming together in one group and shaping the work programme for that. And then voluntary and community and face sector grants. So that's our, like I say, our grants programme that really works to ensure that we can get, even if it's smaller pots of resource out to the community and voluntary sector. One of the elements that we know works is if we can give small amounts of funding to them, they can go out and do the work to bring in funding from other sources. So anything that we're putting into those sectors really comes back, you know, up to tenfold, you know, in terms of what they get in from other areas and the work that they do. Okay. So we have some statutory responsibilities in this area. So crime and disorder reduction is a statutory responsibility. It's mandated by the Crime and Disorder Act 1998 and includes the community safety strategy, domestic abuse strategy. All these have to be produced by us. And that has to be in accordance with the Domestic Abuse Act 2021 and the Serious Violence Duty that we also have to provide a strategy for as well. Then antisocial behaviour management. So we have developed and enforced measures to tackle antisocial behaviour in line with the Antisocial Behaviour Act 2003, but that also plays through the connections that I'm also the director responsible for housing, so that plays through also our own social housing work as well. And then facilitating effective data sharing and collaboration amongst key partners. One of the outcomes often of things like domestic homicide reviews is that we must share data well, ensure that we're doing it under the right agreements, but it's important that we work as a partnership to resolve issues, particularly with complex cases and where there can be prevention on serious issues. Engage with local residents and community groups to understand their concerns and priorities, incorporate those into community safety strategies. That's a key requirement of what we do. Regularly monitoring and reporting effectiveness of safety measures and strategies, and once a year we'll be bringing into this scrutiny an overview report from Community Safety Partnership to show you what's happened in terms of action that you can review, so that will be part of the forward work programme. And then support for victims, so provide support and resources for victims of crime. Often this team, in terms of community safety, will be the ones that, if there is a community incident, will put in a response into the area. So, for example, if there was a knife crime, we would put in a community response to basically give people a chance to air any concerns, ask questions, look at what preventative measures need to be put in and what community support is needed around that incident. And then there's just some statistics on there. These slides will be sent out, won't they, James, I think?
They've gone.
Oh, they've gone already.
They've gone already.
Great. So I'll let Vicky talk through the local area partnerships element.
Could just move that, it's easier, isn't it? So just in terms of, so the slide, and as these slides have been circulated, but the slide just gives an overview of how our locality model aligns to our statutory responsibilities. So I appreciate that that's just quite a high level. So just in terms of where we're at with the locality model, which was your question, so let's answer your question. So pre-election we had two locality models. So we had the local area partnerships, and we also had the Well Northants programme, and neither of those models were sustained, so they weren't permanent roles. So what we did was we did a review of both of those models and effectively took the best bits from both of those models, and that has informed our structure going forward. So I'm really pleased to say that we've been busy creating the new structure, and we have now completed that. We've got two locality and community development managers, one for the Daventry and South Northants area and one for Northampton, and then we've got 6 community development workers that will work underneath those roles, and effectively they will oversee the lapse. So some of the feedback when we asked stakeholders and partners, you know, in terms of the lapse, there was feedback such as the right partners around the table, the engagement with the community and voluntary sector, we want to do more prevention, lack of funding, not having the opportunity of funding. So again, you know, we've took the opportunity over the last few months, and heading to September, where we're hoping to relaunch the local area partnerships, to just try and get some of that in place. So in terms of the funding, we're looking at a community investment fund, so there will be some funding available at that level for the lapse. We're also looking at the monitoring and evaluation around the lapse, developing a theory of change. What we want to make sure we're really clear about what the lapse are, and more importantly what they're not, so that we can be really clear around what we're delivering, and focus people's energies around the priorities and make sure we've got the right people around the table to tackle those priorities. So absolute intention for that to be led by the data, refresh of the community profiles, but more importantly from the community insight that team will be gathering, so they will be out talking to people to identify what are some of those local issues, and we want the labs to focus on where some of those gaps are, but also building on the assets that are already in those communities, so really heavily working with the community sector and the community. So hopefully that gives you a bit of an update.
Okay, next slide please, James. So we work with a number of centrally government-funded programmes, so a lot of the funding that comes into this area is actually from outside sources, so we get quite a lot of added value from it. So Local Authority Housing Fund, we've already procured a number of homes under that programme. We are into the LAF3 programme, so we're just trying to identify whether there's homes available that would work under that programme, but it takes a little while just to get those in the right location, etc. And then we've got the Afghan resettlement programme, so that's ring-fenced central government funding to be spent in accordance with what they're asking for under that programme. We did have a number of Afghan hotels within the area which we have now dispersed everybody into accommodation in other areas. So those were closed. I can't remember what year was that. 2023 or 24?
Yeah, 23.
23. Yeah, so we don't have any hotels for Afghan now, but they're all dispersed into accommodation in either the local area or another area they wanted to go to. And then asylum support, we've got some government funding to be spent in the Statement of Outcomes in Home Office funding instruction. Mainly it's around support for around asylum seeking hotels where we've got community provision. So we have to go in and basically support those hotels and community tensions and a number of elements of that. And then Homes for Ukraine, we've still got ring-fenced central government funding to be spent in accordance with that. That's basically where you've got the Homes for Ukraine scheme, and we have sponsors obviously working with a number of people who are living in their homes, and that's sort of part of the payments, but also we put in place a number of staff around those that will go out and support the families and look for additional help for anybody who's in those homes and needs help either settling or on further issues as they go along, to make sure that those relationships are sustained, or actually resettle somebody if that sponsorship doesn't work. So there's a number of elements that are covered into that. Sorry, next slide please, James. So in terms of service priority, you've already heard from Vicky on the local area partnerships and strength-based asset community development. One of the things we're very clear on is that in order for us to get the best outcomes within our communities, we need to work with our communities properly to understand who are those community leaders, what are the assets that we're working with that are already there, and to work to develop and enable those, rather than us trying to say this is what you should or shouldn't do. It's very much part of the focus that we're moving towards, particularly with local area partnerships, to allow everybody to have their voice in the areas that really matter to them. And then target environmental improvement initiatives, so focusing environmental improvement projects in neighbourhoods. We've got high levels of fly tipping and environmental degradation, and using the kind of asset-based approach to help us tackle some of those, as alongside with the work that the council's already doing. And then safer accommodation for survivors. We've got an operationalised trauma-informed accommodation for victims and survivors of domestic abuse. Certainly within our housing element, we are seeing an increased number of people coming to us in homelessness requirements because they've been in domestic abuse situations. So that's a definite increase in numbers, and the government has just changed some of the legislation around who can come into us for accommodation. So it's important that we have the support services that wrap around that. And then revising the community funding grants framework. So each year we try to look at this and say, actually, what are the key priorities that we have at the moment, and making sure that those grants sit with what the communities are telling us they need, make sure that we're working through and making sure that the projects that we're funding are getting best value for the council and the residents and the local communities. And then updating the community safety strategy and action plans, that's an ongoing basis. So key priorities at the moment: antisocial behaviour, child exploitation, domestic abuse and town centre safety. One of the areas where we have seen an increase in crime, it's probably one of the few areas, is actually in retail theft. So again, we're working with the town centre retailers to work on that as well. And then sorry, next slide, yeah. So delivered community engagement plans, so roll out tailored plans with the communities, work out what those are to build a resilient engagement network. And that's really about getting that ongoing feed in and out, because it's very easy to go out and ask a question on a specific subject, but what we haven't done that well at the moment, and we're working on to get an improved approach to, is people feeding in and out continuously. So we're getting our services developing on a continuous improvement programme, responding to what communities need. And then appoint a new funding officer. So basically we're looking to appoint a funding officer who's going to bring in further funding grants, so that we can both for the council, but also to work with partners to deliver further work about community intervention and projects and programmes that are going to meet some of those needs we're identifying. We've got the LAF Fund Phase 3, which we're looking at whether there's potential properties available. We've got quite a short timescale on it, so we'll have to see where we land with that at the moment. And then optimise use of community assets. So again, this is about not reinventing the wheel. This is about us making sure that we understand what assets are already out there and working to develop those assets rather than recreating something. Expanding Empower Welcoming Spaces, so that's been a really successful approach. Started in the libraries, has rolled out from there really, and it just provides spaces for people to come. Started off as kind of warm spaces, but what it's become now is some universal spaces where people can go when they want help, advice, feeling lonely, you know, social connections. There's all kinds of reasons that people use those spaces now, but it's just open to everyone and you can come in and feel welcome. And then develop and implement a comprehensive youth offer strategy across West Northamptonshire. So again, working with our children's services colleagues to do that. And then finally, so the challenges, I guess, risks and opportunities. So community safety, we've done really well in terms of the reduction in crime numbers. Overall 1.6% reduction in crime. We sit very well with our neighbours actually in terms of where we're performing in lots of areas, and 7.8% reduction in violent crime last year. And a lot of that is down to the community safety partnership work that's happened with partners to really target where that violent crime is happening. But keeping that up at that level is going to be hard with some of the issues and landscape that we've got at the minute. Public perception of crime. So often there's a public perception about crime that isn't necessarily real, but it affects how people feel about going into spaces, particularly the town centre and various areas. It's important that we try and tackle that as well, because we want people to use our public spaces. We want people to feel safe going out. We want people to feel safe in their homes and their areas. So it's important that we tackle that with campaigns and also working on what is leading to that. Rising antisocial behaviour and exploitation, so that has become an issue that we need to be concerned about. We see a lot of it in our own social housing, and there's lots of issues around that, so Vicky's building on the programme for that. And then short-term government funding, so we get funding that's blocks, that doesn't give us a long-term approach, so we have to keep moving with the funding guidelines rather than being able to actually set up a programme that's fully right. So we do try and adapt it to fit what our community needs are, but you've always got to respond to what the requirements are. And then, sorry, where did I get to? Oh yeah, sorry, sustainability of community-led initiatives and capacity of the community and voluntary faith sector. I think we ask a lot of the community and voluntary faith sector, and whilst we are making a decent investment at the moment, there is also the requirement of time, of people that are willing to actually take community action and put themselves forward. And actually we get an awful lot for money that's invested, not just from us, from other spaces. And what we can't do is keep expecting more and more of the voluntary and community sector without actually investing in their capacity and ability, because they're trying to run organisations alongside some of this, and actually that's a really difficult ask. So investing in our infrastructure organisations and making sure that we're working with them is really important. And also when we commission as a council, it's key that we consider those smaller organisations so that we're not making it so hard that they can't interact with us, and we're being very clear about what our ask is. And then just community engagement, low civic participation in some areas. That could be because we're not actually engaging in the right way. And I think it leads to your question earlier about how are you reaching out to communities that are more diverse? You know, how are you making sure that you're getting over where there are different languages that, you know, you need a different response in, and different cultural issues that mean that we're not engaging with people well. So I think it's really important that we keep up that work of understanding if engagement is low, why that is and what we can do to change that. And then it's then maintaining it over the long term, isn't it? It's very easy if we're not giving people things to get their teeth into. People say, well, we've heard this before, or we've been there before, so it's really important that we make it meaningful. And then grants and funding, highly competitive funding environment. We've had 5.6 million out of different grants pots. That isn't always going to be there necessarily, and what we have available from the general fund is nowhere near that. So it's just making sure that we keep up the investment in different ways. And then demand of availability of funding, even with that amount of funding, there's still more demand than we can cater for. And then challenges in demonstrating measurable impact. It's hard for smaller groups. They just get on with it. We're then asking them to actually prove what their outcomes are and what they've done. And I think it's really important that we work with them to make sure that we are doing that in an easier way. And then the resettlement schemes, cultural and practical needs of resettled families is there are high needs, and we need to make sure that we are addressing and meeting all of those. And then community tensions that have occurred in a number of the areas where schemes have been in place have been quite difficult at points. So I think, and just Vicky's just pointed out central government partner funding contributions fund 69% of the roles within the service. So we've actually done really well to make sure that we've got so much more resource behind from what we're getting in the general fund. So there's value for money for the residents and for those communities. So I'll stop there if anybody wants to ask any questions.
Thank you very much, Jane and Victoria. I'll open the floor to questions. Yes.
Alison Eastwood. Firstly, my apologies. Meeting went on longer. Oh, right. Oh dear, no, this is a horrible one, but never mind. Let's see what we can do. My apologies for being late. Commitments otherwise. Anyway, first I would like to say I was privileged to give away Rose of Northampton a week ago. And I think that you are to be commended for the number of volunteers, the standard of volunteers that actually came forward who were worthy, so delighted and invested to help within the community. And I'm delighted that we've been able to magnetise that number of people. Particularly, there were 5 of them from the Lewis Foundation, which I find quite remarkable. I sat on one of the lap boards, and I don't think anybody else in this room did. I think that Matt Gilby led a very interesting programme, and some of the laps were extremely successful. The laps in the rural areas were nothing like as successful. One has to cater to where you are, who you are, and what you are. Because in the rural areas, which Silverstone very much was, now rural south, we run from Boddington to Silverstone over an 85% rural area. And you will discover the farming community ran their own lap system. So it was very difficult to draw them in. And in fact, most of the time they shut the door very firmly in your face. Now, I believe that all councillors on a very regular basis should attend parish council meetings. So we integrated and worked very successfully in a lap system that wasn't part of your lap system, was part of their lap system. And at the end of April last year, before the council was disbanded and the election happened, I had made up my mind to ask as to whether we could scrutinise LAP for that very reason, because I didn't think that we were serving the community across the community. So if we were to produce that on the table and open it up now, it would be wonderful. But I hasten to add, it is a system that could work really well. It's just that it didn't work everywhere. Thank you.
Thank you, Christine.
You did answer a lot of my questions, thank you very much. You did mention that there's going to be a relaunch in September, and I wondered if you know when we might get more information about that rollout.
So what I should have said as well, which I probably didn't say, is we have got an internal operational kind of working group with some theme leads. So some of the areas, and I didn't mention them all, but we're kind of developing all of those things. So there's some things in there around the community profiles and the refresh of the community profiles. We're just looking at, because there's been slight changes to the LAP areas because of obviously the boundary changes, so the data previously aligned to the LAPs and is not in sync. We're working with our local infrastructure organisations around how we structure the community advocacy sector around those LAPs. And the funding, we're looking at community investment fund for those LAPs. So there's lots of things going on. And we're developing a communication strategy. So there's something about keeping people up to date around the fact that they've stopped and when they're going to continue and what that plan looks like. And then there's something about the programme, isn't there, going forward. What are we, July? We're just about to go into July. So I would hope that we'll have something a bit more detailed in terms of dates that we're ready to go live in the next few weeks, next couple of weeks.
So, and just to respond to Councillor Eastwood's question, I think what we can do is bring the new proposal and the way that we're going to work into here, 100%. If you want to take a look at it and review it. I think, and just to add to what you said, one thing about LAPS is it's not the be-all and end-all answer. Not everybody is going to attend LAPS, not everybody is going to input into LAPS, so it's really important that we understand where those other feed-in and feed-outs are, and some of it will be through counsellors, so engaging in the right way and getting the information in is really important, and we're happy to listen, so we'll take some feedback on the LAPS, but if you've got other suggestions as well as part of that we can consider, it'd be really helpful.
I really support the LAPS being on the agenda because actually I think there is an opportunity for scrutiny around, you know, there's something, isn't it? The LAPS are a structure. In effect, they're a partnership, aren't they? And the value is who's around the table and what they're focusing on, and that we need to get right. So we are doing a lot of work around trying to get that right before we launch, but it is an ongoing piece of work because you're absolutely right. There are other structures in those localities that we absolutely need to be mindful of, and we need to know where the LAPS add value. So in terms of setting their priorities, there'd be no point in setting a priority that group might be focusing on if that group aren't going to be at the table. So we just need to be really clear about that. But we are really keen, as I said, on developing a theory of change around what the LAPS are, what they're not, and how we're going to monitor and measure their effectiveness, because we need to measure the effectiveness of that structure, don't we? So I would really welcome that. And then there's the second piece to do in terms of once we identify what our priorities are, how again do we establish whether we're delivering those and whether the LAPS are making a difference and they're adding value. So I would absolutely welcome it being on the agenda.
Go away. There are 3 of us on this committee who actually served on the LAPS. So what I suggest is maybe we do a Teams and you pick our brains, Rosie Herring, Fiona Baker and myself. It might be beneficial because actually, ironically enough, we all come from different areas, but nobody was town, urban. It was all rural. And I think it would be beneficial to us and you, because we have to learn too. We may not have given the right messages locally. I mean, Men in Sheds was a really good idea. And it worked, took off. But don't ask me to actually have a youth club in the middle of the countryside, because the answer is it won't happen. Those children have to hitchhike, their parents won't bring them. So one has to take the good and the bad, the smart and the smooth. And I'm sure we'd all be delighted to share and to help.
Yeah, absolutely. Any support is really welcome. And I think, you know, just going back to isn't it around what are the priorities, what are those LAPS going to focus on, and who is around the table. Absolutely happy to have a conversation. I think the difference this time is, I said a minute ago, the LAPS are just a partnership. They're a structure. But we've also got, with our restructure, some resource in the community development workers to work within those LAPS. So the LAPS are still very big geographies, aren't they? And there's the ability for us to identify where there are priorities within those LAP areas for the community development workers to do some of that intensive work, and then hopefully a community investment fund to go alongside it. So we should be able to measure our difference, I think.
So I just wanted to add, obviously you're going to be looking at what your work programme is after this, so I think if you decide how you want to interact, I know Councillor Purser was waving at me as well, because I think he was on a LAP, but a town centre one. So I think it's important that you work out actually whether do you want a subgroup, do you want it to bring it into here, and then let us know how you want to work with us on it so that everybody gets the opportunity. Because it would be good to hear from people who were on the LAPs, but also people who haven't been, who might have new ideas, etc. So I think I'll leave it with you to come back to us on that.
Thank you for that. Councillor Harris, would you like to address the committee?
Thank you, Chair. Thanks for indulging me. Apologies for that. A couple of points. LAPS, I was on a LAP too. Sorry. Sorry, I'm not on the committee, but I was on a LAP too. It's like, bidding for it. So if there is an opportunity and you set up a working group, I'd be happy to contribute to that from my experiences. I guess there's a couple of things that flag in my mind already. One of the things about the LAPS I think is really important is, as local as it can be, big advocate for localism, and I think it sounds like it might be even slightly bigger than it was before in terms of its base of cover, because I haven't quite got my head around structure. I know you said Daventry and south together and then north. Does that subdivide?
No, so there are conversations out there around the integrated neighbourhoods, which are something different. At the moment, there has been no conversation that would suggest that it won't be the 9 laps. So when I said about the structure, that's the staffing structure to support it. So there'll be a lead for Daventry and South Northampton area, a manager role, and there'll be another one for the Northampton locality area. So they will almost be a point of contact, and we'll have oversight of all of the laps on those two geographies. Does that make sense? But there will still be the 9 laps.
Because that was the point I was going to make. I think that localism, as keeping it as close as you can, is really important. One of the reasons I think they struggled a little bit, you've talked about it already, was funding. There was no dedicated funding, and we put a pitch in a couple of times to try and get funding for it, but didn't succeed. But I think funding going forward, I hope if that does become a reality, that will make a difference. The other thing that needs to be in the mix is accountability. In fact, Alison used the word board. I don't think they really worked as a board. And if I could nudge it in any direction, I would say it needs to be a local board. It really needs that level of accountability and ownership for the issues within its own area. And my experience is there was a lot of really good stuff that took place and happened, but there wasn't really collective ownership of the lap as a whole. So that's just a plea, really. But I'm happy to get involved in that work. The second point, if I may, Chair, you know that in the past we've been advocates quite a lot for white ribbon in the connection of domestic abuse, and I know the council have taken a slightly different route with that particular programme. But again, I would just ask that can we please ensure that we do a full training programme for councillors, because I think it's one of those issues again that sits in our communities that people do not see. It's a difficult area for people to connect with and engage with for obvious reasons, but we are part of our community, and I think the more awareness we have of those issues, the better it can be for us being part of solving the problem. Thank you.
Thank you very much for that. I was pleased that you're saying you really support the small ones and you don't, penalise them, overburden them with regulation and that sort of stuff. I'm very pleased to hear that. Also, going back to your domestic abuse, do you have any figures? How, is it, and it's increasing, you said, so, what was it and what's it gone to?
So violent crime has reduced in the last 12 months, which is remarkable, really, because if you look at national trends, and as a community safety partnership, we're compared to most. We sit in a group. It's called our most similar group, and we're compared with other areas that are very similar to us, kind of in terms of deprivation, and they look at all sorts of things, and we are improving in comparison to those significantly. So it is reducing. Arguably, it's one of those crimes, isn't it, that it's reducing. Is that a good thing? Does it mean that people aren't confident reporters? There's always that challenge, kind of back to us. Some crimes you want to see increasing, but we are developing a domestic abuse and sexual violence strategy, and as part of the CSP board, we've got a strategic board that oversees that, which has got the cabinet member on, but also the services that deliver safer accommodation for us. So once that will be available, that will come to cabinet as well. That strategy, and it's a statute that we have to have that strategy in place. This committee, we will bring the community safety partnership strategy 12 months on, kind of performance overview, which I think will naturally form part of the work plan. Again, it's a statute that we have to do that, but that will go into detail around exactly what the Community Safety Partnership has done in the last 12 months, some of the actions that it's delivered, but also what its priorities are, and will give kind of the most up-to-date stats around all of the crime types. We also publish that on the council's website, so we've got a community safety page, and it might be useful if we can include that in the minutes, actually, if I send it over. But it's got quarterly we put all of the performance stats on there, and again the actions that have been taken by the community safety partnerships. You've just got that kind of overview. We don't wait for every 12 months, you know, that it comes to here. We just try and keep that up to date throughout the year. So I can share that.
Can I just? I think the bit that you're referring to is what I mentioned about housing presentations, so not the actual crime statistics. So basically, the numbers that we're seeing coming to us under homelessness duty through domestic abuse is what's risen. So I don't have the exact figures, but I can get those for you. So I can show you but it's one of our top 3 reasons for presentation.
Okay. I think that's a really good point, because those are police figures. So if you spoke to, you know, if you had the conversation with domestic abuse services, they'd probably tell you that the demand's gone up for services. And as Jane said, in housing, we've seen that increase around domestic abuse because people won't always go to the police. It's not their first point of call. So, you know, it's you have to kind of look at it holistically. But police figures, it's going down.
Yeah, and could you elaborate on the child exploitation? Where are we getting that from? Is that local? Or are we importing problems with like county lines and that sort of thing?
I think it's probably both. And again, we can bring back some, you know, more detail in terms of what those current figures look like. It's a national issue. It's definitely a national issue, and something that the cities tend to see, urban areas tend to see more of. However, we do see it out more into the rural areas. Some of it is county lines, absolutely. We're in a space that we're really good in terms of the network, so we fall victim to that for sure. But there is also, you know, there are also examples of exploitation which isn't linked to county lines. We're working really closely with schools and also the Children's Trust, the Children's Safeguarding Partnership around activities to tackle child exploitation. But it's difficult, and it's definitely a rising issue for us. So it's absolute priority for us for the next 12 months.
Okay, thank you for that. Yes, please.
My question is, what is there for the youth? Any youth provision that can divert the youth from antisocial behavior and drug activities and all the knife crimes happening? What is there? How do you address to help the youth with these provisions?
So I would always say there should be more, but there is actually a lot out there, and it's about how young people are getting access. It's about how they access it, isn't it? We have fairly recently funded one of our local infrastructure organisations to establish Young Northants, which is a collaborative of youth providers, so organisations that are providing youth work across West Northamptonshire to come together to develop funding bids together to kind of strengthen their capacity to bring money in for additional youth services and youth work. You'll be surprised how much is really out there. There is a lot out there. Questions around affordability for sure. We use the funding grants that we spoke about earlier to fund specific programmes of work and extra provision. Youth provision is something that's an absolute priority for us. So, you know, where we receive bids, we will fund that. Where we see there's particular issues and there's been a gap identified, we'll fund that. It's absolutely something that I would hope the Community Investment Fund could do through the local area partnerships if we're identifying there's gaps in local areas.
In fact, in Castle Ward, where I represent, we don't have many of these youth and centres or anything that can help the youth. I just identified one, and during the campaign, I have seen so many youth, youngsters, just hanging around doing all sorts of things. But then with the one we have in Springboroughs, the Spring Youth Centre, that's the only one which is just across, like many youth are using. And in fact, it needs a youth worker that can help out with many activities that are happening and the age differences. And you will see youth as old as 18 with some 13-year-olds mixed. So I don't know how we can help to.
Yeah, and I think there's opportunities, isn't there, through funding that's available to be able to fill some of those gaps. I'm really familiar with it's the Springs Family Centre, isn't it? And there's some great work that's going on there. There is something, isn't there, around activities that are on, but are they what the young people want? So there's an element, again, isn't there, of engagement with those young people to establish what is it that they want in that area. Where sometimes we make assumptions, don't we, that it might be sport. Actually, it might not be sport at all. It could be music. So we are looking to develop a youth engagement strategy, and somebody in my team, a role that's been joint funded between communities and public health to absolutely do that. We've set up the youth council so we can get the young people's voice and really understand what it is they need. Because us making assumptions, that we're going to put activities on that they're going to come to, they really need to be part of that, don't they, and develop that. We need to make sure that stuff that we're funding is stuff that young people want to access. So there's a whole piece of work for us to do around engagement. And I'd see these as some of the conversations that we might be having within the local area partnerships.
And as a councillor, I'm sorry to come back to you again. I'm really happy, and I've been going around to the community leaders, and I'm happy to take the initiative to help the council, how we can improve the youth services and all that. So in case of any opportunities, as councillors, all councillors, I think it really touches us, what's happening around and everywhere. I'm happy to help, whatever comes on board.
Thank you very much for that, yes, Ellie.
How much you talked about a youth strategy, how much, I know it's very hard because a lot of schools are academies and very much individually run by the heads, but I always think that a lot starts obviously with word of mouth, but a lot starts with education. So how much of a link is there with advertising in schools, so the schools actually know about the youth provision?
So you're absolutely right. Schools are massive, aren't they? In terms of us, in terms of lots of things we do. So as a community safety partnership, we established that a long time ago. So we've got a couple of, which again you'll hear about when we bring the report back around the community safety partnership. But we've got for secondary schools and primary schools, we've got a designated safeguarding leads forum, and we've got about 85 of the schools across West Northants that are attending that, which is great, and that's really an opportunity for us to talk about things that we want to get through to schools, but also an opportunity for them to tell us some of the emerging themes and issues that they're seeing in schools with children and young people. So that's kind of how we communicate with them. There's also the education team, so Ben Pearson and his team have got direct links into the schools. They have a newsletter that goes into schools. So whenever we're aware of stuff that's going on, we'll send that directly to go out through the various platforms that schools are on. And then obviously networks and people within the community, that's really important as well, isn't it? So I know through some of the local area partnership work, and again I know it varies from lap to lap, but there were some schools engaged in some of those laps. When we have had incidents in the community, Jane spoke earlier about our critical incident response, we will bring in schools. So we will bring in the designated safeguarding lead or the head teacher and work with them. We'll go into schools and deliver things in schools. So I'd like to say, it's not perfect, but I'd like to say we've got quite a good link into the schools, and absolutely they're part of our strategy, our youth engagement strategy around getting the young person's voice. And the youth council, the young people that are nominated onto the youth council come from schools, so from schools across West Northants. So again, they become the representative that feeds back in to their schools. So I feel like there's quite a strong link. As I say, not perfect, but...
Thank you. One more, Hilly, yeah?
Sorry, another question on the local area partnerships, and it's more really to do with Jane. You mentioned about improving outcomes. Is that currently measured? And if so, is it measured in an easy, universal way? Because obviously, the last thing you want to be doing is heaping on more on people that are volunteering and doing vitally great work in communities. But I'm just wondering how it's measured and how the more positive and the things that are really working are really improved upon and shared.
Yeah, so we tried to make it fairly straightforward. So obviously there's 10 Live Your Best Life outcomes, and each of those have a set of key indicators underneath them that we work within anyway. So for example, the housing one has a number of indicators that are worked on anyway. So we're trying not to put any extra stress on the system by adding indicators that are difficult to measure or that we're not measuring already. What we're trying to measure is the impact and the difference that the local area partnerships make on that specific outcome. So we'll look at where we start in an area, and then we'll look at what difference those interventions have made to that outcome, rather than trying to create new outcomes that they've then got to adhere to.
Thank you for that. Joanne?
Hi. I have a question going back to the youth you talked about going into schools and that kind of thing. How are you encompassing the home-educated children?
Yeah, so there is a specific team within the trust that will work with those not in education. That's not our team. And I'm sure they'd be happy to give you a bit more detail just in terms around all of the work that's done around that specific cohort. But we work really closely with the police. We also, I said earlier about the designated safeguarding lead. So some children that aren't in mainstream education but might be in other forms of education, we do reach out to those as well. But in terms of kind of that direct reach out to those that are homeschooled around the projects and the work that we're doing, there's other services within the council that have got those direct links. That's not our service specifically.
But how do you I thought you were talking about youth clubs. Sorry, we're talking about youth clubs and how we can keep children safe, because these children, they may be home educated, but a lot of them could be out in the community too. So why aren't they not involved with this?
Yeah. So they are not necessarily through our team, but through the Children's Safeguarding Partnership and Ben Pearson's team, the education team. So they've got those direct links into those children that are homeschooled, that aren't in mainstream school education, but are in those other settings, those that are homeschooled, those that might have been in school and have gone, that have left. There's a whole programme of work that goes on from our educational team, working with the Children's Trust around that particular cohort.
So do you bring that all together, collate it with that department? Because you talked about different people from different cultures, you talked about going into the schools directly to find out what they need, but then would you bring in that from the home edge, because they seem a little bit out on a limb?
Sorry, so just to be clear, in terms of working with that cohort, obviously the Children's Trust have a responsibility around that. The services that we offer are much more community-based. That doesn't mean that children from homeschool education won't attend those, but we don't specifically target that group or work with that group in that way. If they come to events or we're working with local youth clubs where they would go to, it would be that. But in terms of specific provision for homeschooled children, that would be the Children's Trust. And there's a children's, obviously, scrutiny. So if you wanted a report to go in on homeschooled children and the kind of activity that takes place around that, I'm sure that would be a welcome addition to their forward programme.
There is loads of stuff, honestly, as well, in terms of going on, and it would be really good to make that link just so they can give you the full understanding, because I know, as I say, we do work with them, and I know that they're doing a lot in terms of that outreach. So Ben Pearson would absolutely be happy to feedback. Ben Pearson.
Thank you. Yeah, Hayley, please.
Sorry, just one more thing. I do home educate, so I do know that there's an awful lot going on in the home ed community from, you would not believe it, from children all over the world having marvellous opportunities. But obviously it would be, and I've had children go through school to balance it both ways, you know, because I think it's very important to get the balance, like Councillor Blythe said. But it would be very interesting to know sort of figures in the community, but I'm sure that's probably, you know, gauged already.
So are you talking about from the homeschool education, or are you talking about from more generally the kind of any youth provision that we're working
Yeah,
with?
I'm talking about sort of generally from the youth provision, and I feel like there's probably, you know, a good mix of children across the board. But, you know, in terms of what school they go to, or if they don't go to school, or if they're in alternative education provisions.
Yes, sorry, I really want to be clear about the services that we offer within Vicky's team and the difference between that and the Children's Trust. We don't necessarily work with those individual children. We're there to enable communities to work with those children through youth provision, through grants, through voluntary sector organisations. So our links to individual children is not really where we're placed. We're much more about the other services. However, obviously the Children's Trust would have a different element because they're working with individual children and families, etc. So would education. So the figures that we can give you is about what groups we enable, the kind of work they're doing, the projects that they're doing. It won't be about individual children.
Okay, that's fine. Thank you very much.
Thank you, Alison. Yeah, sorry, thank you. Bob, please.
Yeah, can I come back to the same question I asked? What are the things you'd think that as a scrutiny committee we could usefully look at within this area? I'm now here very clearly the lapse issue, and that seems to be something that we can. Well, I think we need to be very clear what we're trying to do there, but I think certainly around the lapse is certainly one area, and obviously your annual report. But are there any other areas where you think we can as a committee, make a contribution?
Yeah, so I think it's probably as we're kind of shaping the new grants programme, it would be good to bring that into you so you can look at the priorities we're setting. I mean, clearly we try to work with the corporate plan on those, but also what we're seeing in terms of needs. So it would be good to get your oversight on that. Probably as well as we work more through the domestic abuse approach, it might be good to bring that back into you when we've got the strategy as well, and just take a look at how that's working across the different areas. That's okay. I think those would be the key ones.
That's 3 things we've got to do, so that's plenty.
Thank you for that. Does anyone else have any more questions? Please, Scott.
Hi, yes. Regarding the targeted environmental improvement initiatives, I represent a ward that unfortunately has a high level of fly tipping, and I would say targeted environmental degradation as well. Can you just
Scott, excuse me, that's not a question for this committee.
It's on our presentation.
Yeah, we just...
Sorry.
Do you want me to clarify what's on there? No? Okay.
Oh, James.
I think what this is showing, Chair, both in relation to the last point and the youth services point, unfortunately, we don't have a situation where the remits of scrutiny committees exactly match the remits of directorates or cabinet portfolios. That's probably fairly typical for any authority at any time. It would be incredibly neat if it was the case where everything matched with everything else, but it's not the case. So there can certainly be cases where you have a cross-cutting topic. It might spread across the remit of more than one scrutiny committee, in which case there's a mechanism through the triangulation group to look at that, to look at if it's going to be scrutinised, where does it best sit. But yeah, you'll frequently come across situations where directorates cover the remits of more than one scrutiny committee.
Yeah, thank you. Did you have any question on the adult services?
Yeah, I was going to get to it, but thank you. I was just wondering if that could be integrated into how can we help deliver better outcomes in, you know, fly tipping in the local area by actually engaging adults with. We do a lot of work with Canto in the local area in Talavera. It's an adult social care, so that's just the where I wanted to link on with that.
To answer, to be so in the report, one of the priorities do allude to, you're absolutely right, environmental initiative and using the asset-based community development approach. So that is exactly that. So we have before, you know, you go into areas, you do a day or a week of targeted action, go again, and then, you know, next week everything's the same. The idea is that we use asset-based community development to change behaviours and engage with people to identify, you know, how do we stop people fly tipping, and some of that, you know, is about encouraging people to put the bags out on the right day, not 2 days before. Some of it might be language barriers. People just don't understand or haven't received the information. So it's about that targeted approach to talk to people, to try and bring people with us to improve that area and get the community involved. So that's what that initiative is about. And because we do asset-based community development, we're using that approach, and I'm supporting that initiative. Because we're the Communities Directorate, which you can imagine we just cut across that. We do cut across everything, so I'm sorry that we are confusing you. But yeah, but that isn't, again, I'll just be really clear, there is an environment, there is regulatory services that this fits under who are doing a whole load of other things, but we're just supporting with that targeted approach within communities.
I think just to add to that, because we're prevention focused, we will be focused on a number of areas that will cross-cut across other scrutinies. So we're basically here to give an overview of the whole service, which is what we've done. But I guess the things that need to be brought in here are the things that fit around the adult side and the prevention in the adults world, if that's helpful.
Yeah, thank you.
The officers have left, and it is that I came with 2 proposals today for the adult social care. One is, and I hope Councillor Passa will help me through this as well. One is closing the gap of health inequalities in West Northamptonshire, especially Castle Ward, where we have a report from the Director of Public Health.
Yeah, if I may, the 2 presentations we've had today, they're going to be supplemented by 2 more with the next meeting on the 2nd of September, and one of those, we're going to get the overview from public health then, and that's probably more where your question would probably lie, by the sounds of it, with the public health people. And we'll get a culture and leisure and communities overview as well at the next meeting. It'll be probably better addressed there, or you can see Councillor Purser out of the committee, so we can move this forward, if that's okay. Well, if there's no more questions, I'd like to move that we go to the outcome.
Sorry, I just wanted to propose for us all in our future meetings that we could do maybe some scrutiny work on young adults and how they transition, you know, into later life and benefits of really having great community input when you know, adults of 18, 19, 20 sort of year olds.
So again, that would be with adult social care area. So I think, again, in terms of the next item, which is the forward plan, you probably want to, I don't know if you want to move on to that and start suggesting stuff, but if there are any more questions for us, we're happy to answer them in terms of communities or community safety.
No, I think that's very good, ladies. Thank you very much for that. I'd like to move to the outcome. If we can, committee can note the content of the presentations and give due consideration to the information that's been provided during the process of developing the committee work programme for the 2025-26 municipal year. I have a show of hands to do that. Thank you. Okay. Development of the committee work programme then. I'm going to hand over to James.
Thank you, Chair. And I have a brief presentation, and I apologise because some members who are on other scrutiny committees that have met already will have seen it already, but it's very much a scene setter before going over to councillors. So this item is really about getting you into developing the work programme for the committee for the year. And I mean, really, when it comes down to it, when you get to the business as usual stage, a work programme, it's obvious what it's there for, what it's designed to do. So it is literally a plan of the work to be done by the Scrutiny Committee in the year ahead. It gives you your framework for what you then go on to do. And it will look something like that, filled in. So you'll have a list of topics, the purpose of each topic, what you're intended to do from it, the date when it's to be done, which could include an item at a single committee meeting, a piece of more in-depth work running over a longer period, or indeed it's perfectly normal for a scrutiny committee to identify a topic it wants to look at, but not specify when at that point. So it remains on your longer list, so to speak, and as the year progresses, you may plug that in to a particular time, a particular date and time. The approach you want to bring to bear on a particular topic area, of which there are various. So an item for discussion at a committee meeting, so something that can usefully be dealt with in a 45-minute session, say, at a public committee meeting. Or a task and finish approach, which can be something that might be dealt with in 1 or 2 meetings, so what we call a spotlight review, or something that runs over a longer period. Your real in-depth investigative evidence gathering work done by a task and finish panel. And then who do you want to involve as the subject, as the focus of your scrutiny? So is that going to be a cabinet member or a senior officer to a committee meeting, or again, if it's a more in-depth piece of work, there will be several invitees, several evidence providers you may want to hear from. So all of those kind of factors, what go into, will be listed in your work programme when it's developed. The purpose of a work programme, why do you have one? Well, the Centre for Governance and Scrutiny, which is the national organisation that advocates for scrutiny in the public sector, says that. So it's the foundation of an effective scrutiny function. Done well, it should ensure that your work is targeted, incisive, and timely, and focuses on issues where scrutiny can make a difference. And it should prevent you from doing bad scrutiny, which is where it uses time and resources where there is minimal outcome, minimal impact from that work. So thinking about how you go on to develop your work programme, so understanding the committee's role and remit, what it's there to do, and the areas it's there to do it on, which hopefully we've started you off with the 2 earlier presentations tonight. So, and then consider what you want to do, why you want to do it. So what outcome is it designed to achieve? What difference is it designed to make? How you want to do it. So picking up on the different working methods available to you, and when you want to do it. And that can be, scrutiny can often be in a situation where it may identify, well, this is an area we want to look at, and you may need to think further about, well, is it an area where the council is already doing some work? How does scrutiny then fit in? How is it best timed to complement what might be being done on a corporate level, rather than duplicate or cut across it? Any scrutiny committee at any authority at any time, anywhere, is always likely to have more things that it could do than it reasonably has the capacity to do. So prioritisation is absolutely a key to developing your work programme, and then keep the work programme under review. This isn't something that's decided at the start of the year and then stuck to rigidly as the year progresses. It's customary for the work programme to be reported to each regular scrutiny committee meeting for precisely the purpose of keeping it under review, modifying it as necessary, adding things when priorities change, and also, crucially, taking things out, because you add something and that leaves you trying to work at 110% of capacity. That's not realistic. That's not a good use of your collective resources. You've got an opportunity to start considering the work programme tonight, and I think that is a case of starting to consider it. I think there's a general recognition that we're coming into this with a newly elected council, with councillors in new roles. There will be a process of evolution. There will be a process of getting to know the landscape you're working within. And to reflect that, I think as a minimum, we're looking at having an initial discussion of the work programme at the committee meeting tonight that could lead to some more worked up, more detailed proposals being brought back to the committee meeting in September for your final approval. That's as a minimum. It may take longer. And as I say, again, it's not a one-shot or even a two-shot deal. If you agree the work programme for the year in September, then it will be brought back to you at all of your subsequent meetings, so you can modify it as necessary in any case. And we also have the triangulation group, which plays a role in work programme development, implementation and coordination. So the triangulation group is the group made up of the chairs and deputy chairs of each of the 3 scrutiny committees, the cabinet members and the senior officer team. And those triangulation group meetings are really intended to be more forward-looking over the longer term, so have the kind of discussions around what has the council got on its corporate radar, and what areas coming out of that are ones that scrutiny might assist with, and also to play a role in coordination between scrutiny committees. So if you do have a cross-cutting topic, well, who deals with that? Who is best placed to do that scrutiny, so that it's done once in a coordinated way, rather than 2 scrutiny committees working without reference to each other on similar or indeed the same areas. So thinking about what, in general terms, what topics go into the work programme. There's also a need to take account of any statutory functions. So in the case of this committee, it has the statutory responsibility for carrying out health scrutiny for West Northamptonshire Council. So that means the scrutiny of the planning, provision and operation of the local health service. So there is scope for the committee there proactively to identify, well, are there any health-focused topics that it wants to look at? But there is also a statutory role. NHS bodies that are proposing to make what are referred to as substantial developments or substantial variations in local health services are required to consult the relevant health scrutiny committee on those proposals. So that is something that may come forward from NHS organisations that the committee may need to think about as the need arises, incorporating it into its work programme. And then the second statutory element of this committee's remit is scrutiny of crime and disorder, which has already been touched upon. So that is scrutiny of the delivery by relevant partners of crime and disorder reduction strategies. It must be carried out at least once every 12 months, which in practice means the relevant scrutiny committee receiving the annual report by the West Northamptonshire Community Safety Partnership and considering that as a report of performance over the previous year. And then again, talking about which topics in general terms the committee might choose to scrutinise. That can include topics suggested by the previous Overview and Scrutiny Committee, and just a couple of points that it highlighted arising from its last meeting. So it thought it would be good for its successor to do regular scrutiny of adult social care performance, as it did, and something that's been referred to already, scrutiny of the outcomes of the Care Quality Commission inspection of adult social care services. So those are things that can be fed into the mill, so ideas from the previous scrutiny committee. We've heard some suggestions at the meeting today from the service leads, things the committee might consider, and members of the committee themselves have started to touch on individual suggestions. All of that can be fed in, all of that can be considered. The crucial thing is that this committee decides this committee's work programme, and that is prioritised, realistic, and ultimately focused on areas where there is most scope for the committee's work to make a difference. Happy to take any questions on that, Chair, but otherwise it's over to members.
Does anyone have any questions for James? In that case,
actually, I'd just like to say thank you. That was very clear, very concise.
I wonder, Chair, if over we've got effectively 2 months before our next meeting, so over the summer months, perhaps if I am elected Chair at the council meeting, perhaps I meet with the Vice Chair and and James over the summer, and we bring together the various things that we've heard so far and begin perhaps to bring a list to the next meeting, and then at the next meeting we could perhaps begin to prioritise that and say which ones we can begin to put a bit of a timescale to that. Something's not, like the CQC thing is going to take a number of months to come through, but there are other things where we might want to get on with things sooner, and to work out which are things that committee as a whole would want to do and which things we'd want to set up task and finish groups to get on with. And I'm a kind of bit of a believer in task and finish groups that do something and get on with it. And what I'm keen on is that every bit of work we do goes back to Cabinet for them to enact, so that things don't just stay here, that it does actually end up back at Cabinet for them to put into practice what this committee is recommending, subject to obviously they have resource issues to look at. But I think that should be the process, and that we should be working on very targeted things quite speedily, so that things don't take a long time, but so we hone things down so that we can begin, to have made a difference in this relatively quickly in this council's life. That's my suggestion. Reality will come along as well. So
thanks very much for that, Bob. We're mindful of the council meeting on Thursday. I'm minded to suggest that we all think about items that we might like to put forward for discussion at the next council meeting to put on the work programme at that time, and you can liaise with Bob and Hayley. In the meantime, if you want to get those items forward, can we do that? Is that okay?
Oh, certainly, Chair. So a couple of points on that. noting Councillor Purser's keenness on task and finish panels, I think just a slight note of caution that I'd always advocate for identifying what you want to achieve, what you want to do, what you want to achieve, and then thinking about the best way of taking that forward. It always raises hackles slightly when you see that when you risk having a situation of a committee forming a task and finish panel and then working out what it's going to do, and then they find, well, maybe a task and finish panel wasn't the best way of doing what they want to. I don't know if the committee would, each of the other scrutiny committees, I think, in looking at their work programmes, have agreed they wanted a virtual meeting, a Teams meeting of the committee members between now and their next meetings to give further thought to work programmes. I don't know if that's something this committee would find useful as well. So that wouldn't be getting you all together in person in one place. That would be a Teams meeting at an appropriate point to help inform the worked up work programme that goes to next time.
Yeah, thank you, James. Good idea. Christine?
I think that's a really good idea. My concern is September's a long way off, and I think we need to keep a focus. I'm mindful of James's comment that this will be a rolling agenda and things may well evolve as time goes on, but I think it would be lax of this committee to sit on its laurels and wait to make a start on things. So I think the idea of an interim Teams thing and feeding through the chair and the vice chair in order that September's meeting is a little bit more focused and a little bit more productive than it might well just be, especially if we've still got two further presentations which are going to take up a chunk of time as well. I think we need to be focused. So I would welcome the interim and Bob's suggestion of chair and vice chair.
Yeah, thanks very much for that, Christine. Yeah, absolutely. As we've discovered, it's going to be a rolling programme, so there's no problem organising prior to the next meeting some points that you want to bring forward for discussion at the next committee, and keep in touch with Bob and Hayley, as we will do throughout the next few months as well.
Would it, sorry, through you, Chair, would it be fair to say, if there was one area of work identified by the majority of the committee at this meeting, it seemed to be lapse. So as a potential area of work, whether that could possibly be an item at a committee meeting, it could possibly be a more in-depth piece of work, it could possibly be the first one and then the second one, with the second one shaped by the first one. But yeah, that seemed to be an area in which there was various committee members saying that would be a good focus for scrutiny.
Yes, thank you. Yeah, is that going to be our first item to look at, lapse?
Do you want to vote?
Yes, Chair.
Yeah, show of hands if you're happy with that. If you want, yeah. Okay, that's carried. Yeah.
And what is quite interesting there is that it cuts across the health side and also the community safety side, and it's quite interesting that in prior to the summer, LAPS very strongly lived within the health estate, if you like, within the council, the public health bit. It seems to have moved over to the community safety side, and I think there are issues about that. And I think the original focus of the LAPS was very health oriented in terms of the targets that were set, that were very much about health priorities. And I'm quite interested what's happened there and why and how we get the right priorities within the LAPS for each area. But sorry, I'm almost getting into that meeting. But
and is there anything else that came up at the committee meeting this evening that you want to put a particular marker down for? So effectively, you have to receive the annual report from the Community Safety Partnership. That's a statutory requirement on the committee. Would you want to say at this point that you would want to look at the outcomes of the care quality inspection of adult social care?
Yes, we absolutely do. Absolutely do. We're just not sure when that's going to happen yet.
Indeed.
That could be after the next meeting.
Oh yeah, and this is a prime example. You know, the committee doesn't have to put something in its work programme if only if it's able to say, this is what we want to do, this is exactly how we want to do it, and this is exactly when we want to do it. It's perfectly normal for it to say, well, we want to look at the outcomes of the CQC inspection. That will be in the work programme, and when we know when that's happening, we will confirm when the scrutiny is being done.
Yeah, I think I've got, the other things I've got on my list, I've got a list which I don't know if it's helpful or not. One is the changing relationships with the ICB. I made an agreement with myself. I wouldn't use initials and things, and I am. What's this care board? It's the integrated care board, which is the health infrastructure. And I think we really need to learn what the implications of that are and how that relates to what the council is doing. I think that's a pretty key area. There's something about so the workforce plans. I've got something on health, on the recruitment into the skilling and recruiting into our care services. So that whole area, and I've got the monitoring the performance framework, which came out of the minutes of the previous meeting from the so those are the areas that came from the health side of things. And then from the community safety side, I have my notes: grants, domestic abuse strategy, so the grants priorities, and it might be this is not something for this committee specifically, but I picked up this issue of transitions from young people's and children's services into adult services. And I think that's a cross group issue, and I think we probably need to feed that into the triangulation meeting, and that's not a new theme, that's a long-term ongoing theme, and I'm not absolutely sure, I'm pretty sure we haven't got it sorted right actually, or there'll be areas of service provision where we haven't got it right at all. But that's quite a big agenda, bearing in mind that we've still got mental health stuff. We've got too much already, but there's some big issues around mental health still to pick up, I think. But we won't talk about that tonight, but we can perhaps hear about that next time and decide what we need to pick up. Thank you.
Yeah, thanks for that, Bob. As things obviously can drop in and drop out on a rolling programme, we will be able to discuss that throughout the time that we have between meetings as well. Sorry, Haley, did you want to say something?
It was just to share an idea with everybody, and that was, I think it would be good to do some scrutiny on prevention work, because that was particularly highlighted earlier on in the adult social care.
Yes, if we can prevent a lot, it'll be easier. Alison, you were first.
With your approval, the 3, 4, 5 of us who served on the laps, do you mind if we meet with the officers to give them a download of what went on and where we feel that you might want to pick it up? Because it might save some time in a meeting like this, so that they weren't constantly working in referral to our south, which is no longer appropriate. That's history. But we might learn from having travelled the passage. So as long as that's all right with you, we would go ahead.
Yeah, thanks. That was precisely my point of saying let's leave it till the next time while we think about it and discuss it and sort it out. But yeah, thank you. That's a great idea. Christine?
I want to pick up on Farton's comment about communication. For me, there is something that's linked to prevention and communication around how do we get service provision out generally. I have personal experience of a mother who had dementia, and nobody in my family had ever done that before. She got sick in that unique way, and we didn't know what we didn't know. Now, my mother lived out of area, and I cannot speak highly enough of Rotherham Metropolitan Borough Council. They were outstanding. But Mum had me who could navigate through. And I'm mindful that there are lots of people out there, and whether it's language barriers, whether it's because they are isolated on their own, whether it's because it's not clear to people what's available, I think there's a whole raft of clarity of communication that certainly would help with prevention. If you know what's available and you can access it, you can stop things happening. It helps with people getting access to provision. So I think just to put this, it's a bit of an umbrella term and it clearly needs some focus, but there's something around communication and how we get what we do out there into the communities wider that I think is really important, and I would want to stick on the consider further list.
Yeah, that sounds good. Communication can be another item for the agenda. Thank you for that. Anyone else?
Just that we haven't lost Fartoon's two topics either. As an authority.
Thanks for that, Bob. Yes, James?
I'm just picking up on Councillor Purser's comments. Health inequalities is exactly the kind of issue where it would be really crucial for Scrutiny to put the right amount of thought into the scope, the focus for the work it was going to do. It's an absolutely massive area, so many factors, so many different organisations involved from all different levels up to national. You know, Scrutiny could spend sort of years looking at health inequalities. It won't have that amount of time. It will be crucial. It'd be crucial that you translate the idea into a scope, a focus that has the potential to have most impact using the amount of time available.
Yeah, thanks for that, James. Yeah, so with the list, once we get the minutes out, you'll have a look. You'll be able to pare that down. Focus on what you want to focus on. Anybody else want anything to consider? Oh, okay, thank you for that then. Well, I'll ask the committee then to identify these matters for inclusion in the minutes. They're all, you've done that? Right, great. Thank you. Any item 15 then? Any urgent business?
No, Chair.
Excellent then. In that case, thank you very much. It's been a good experience and I will close the meeting now. Thank you.
Thank you.